Okay, here's our video today on deer ticks and Lyme disease. And the reason why it's called Lyme disease, not because anything to do with the citrus fruit lime, because of a town. That's why. I'll write it over here. Lyme, Connecticut. That's where they first recognized the disease in the 70s. So we'll say Lyme, Connecticut. That's where they first recognized it. And they didn't call it Lyme disease back then. They called it Lyme arthritis until about the 80s, around 82, they found that it was caused by a bacteria. And we'll talk about that bacteria. We'll talk about the symptoms and so forth. And as you notice, and we can notice in the picture behind the title, there's the tick. It's a special tick. It's a deer tick, right? Deers carry this, obviously, because they call it a deer tick. And it's actually a black-legged, you can see the legs, a black-legged tick. Black-legged deer tick, or just a deer tick. And it's an arachnid. It's not an insect, it's an arachnid, because it, like spiders, right? Just like a spider in the spider family, it has 8 legs. And we'll talk more about that. Now, the ticks, by the way, they're not sanguivores. Not sanguivores. It's a fancy name, by the way, sanguivore. A sanguivore, like bats, certain vampire bats, for example, or mosquitoes, they're sanguivores, right? And you can, I have some videos on that, but sanguivores just eat blood. And you think, well, ticks eat blood? And yes, the ticks do favor blood, but they will also have other they can also eat tissues. Tissue fluid, for example, sounds disgusting, but so they're not completely sanguivores, even though they do primarily eat blood. So a sanguivore, like a vampire bat, again, or a mosquito, they only feed on blood. So I can put here, they can also feed on saliva, and they can feed on saliva, they can feed on other tissue fluids. So they're not picky, even though they prefer blood. There's some might feed on sap or nectar. And again, they're going to wait on the grass, the tall grass, waiting for a host so they can suck their blood. So let's look at the bacteria, because this is caused by a bacterial infection. And the bacteria is primarily carried by ticks. And so let's look at that bacteria. And this is not a bunch of purple string. This is the bacteria. This is the bacteria that causes that infection. And they're very resilient. They're very strong bacteria. And the name, let's get our pen going here. This is Borrelia burgdorferi. Say that again. Borrelia burgdorferi. We'll just say Borrelia in this video. Let's spell it out. Let's see. Let's use that color. Why not? So, Borrelia and Burgdorfia. Burgdorferi. Sorry. What a mouthful. There it is. Borrelia burgdorferi. It's spiral shaped, as you can see from the video. And it's carried when the tick bites into tissue. So let's look at that. So here's the tick biting into some host, some poor host. Let me get my pen working again. And you notice its mouth parts over here, just like spiders and scorpions have. This is called chelicerae, by the way. It's another fancy term, chelicerae. Let's write it down. Chelicerae. Chelicerae are, again, the mouth parts that bite into the skin. And when they bite into the skin, of course, the Borrelia Burgdorferi go in that to the host. So in the saliva of the tick, this bacteria, the Borrelia, goes into the host tissues. And some say that for it to be effective, the tick must be feeding on the host for more than 36 hours. That's what they say. Of course, there's reports earlier than that. So, just because you see a tick once on you and you plunk it off, doesn't mean that the Borrelia couldn't spread. But the chances do increase the longer it stays on you. So the bacteria will spread once it's in the body, and of course our body will respond. What do we have? Guess what we have? We have an immune response. Like for anything, we have an immune response. The cavalry will come to the rescue. And so you see this bullseye, which I'll talk about in a minute. So once the saliva and the bacteria, the Borrelia, go inside in the blood system, we have, again, like I said, an immune response. And I said cavalry because we're talking about our friends, the white blood cells. The white blood cells will come into action. The white blood cells, our friends, right? We have trillions of them in our body, right? So, and especially we have the lymphocytes. And of course our friends, the neutrophils. And what's happening here, and this is interesting about the bullseye, is you just see the bullseye. This is, let's change the color a little bit here. Let's use yellow for a minute. So right here, this is where the initial infection was, the initial bite. And you see it's spreading, and what's happening is here, it's this bullseye is the body trying to contain it. So it's trying to create like a perimeter, in this case a circle, so we'll say the circumference. But we'll just use like in army terms, we use cavalry, let's use another army term. Trying to make a perimeter to contain the bacteria. So, well, right over here, and we'll change the color again. Changing color a lot today. The immune response, the immune system. Let's thicken that up a little bit. The immune system. Well, it's the same actually. The immune system, the immune response, or some people will say the inflammatory response, it's going to expand, as you can see from the bullseye, it'll expand concentrically, like making a circle. And so the inner dark, right here, this is the initial bite. This area here, what I just marked in yellow. And so again, the neutrophils, the lymphocytes, they're trying to contain it, so you see another bullseye. The outer circle is where they're trying to contain the spread. That's why it's a circle. It's like common sense in a sense. So now let's look at some of the symptoms of Lyme disease and the cures. So if you're bitten by a deer tick, or any tick for that matter, you want to look out for these symptoms. You want to remove the tick as soon as possible. That's why it's always important when you're in the woods. And deer ticks love tall grass. They love the woods. You'll see signs at state parks, at federal parks. In any park, you'll see signs, beware of ticks. So beware of that. And if you're going out walking, protect yourself. Make sure you're using tick spray. Watch out for the tall grass. Stay on the path. But anyway, the first symptoms could happen within days, 2 days later, maybe a day later, or a week later, and there you will have it. You have all the symptoms in front of you there. The flu, you could feel a fever, maybe you have a headache and joint pain. So you should see the doctor right away, especially if you think you were in the woods and you saw a tick. Remember, like I said earlier in the video, the longer the tick stays on, the more that bacteria, do you remember the name of the bacteria? Borrelia, there you go. The longer that could spread within your body. Stage 2 could happen weeks later or months later. That's the weird thing about this. It could happen months later. You can get nerve pain, and you're seeing it, and so forth. Maybe heart issues. You're feeling something's going on here. That's why it's very important to get this checked with the doctor. And what's interesting is stage 3. If you reach stage 3, I'll get my pen going over here. There we go. See, notice it says years later. Getting joint pain, brain fog, can't sleep, and so forth. So yes, the reason why is, like I said earlier in the video, Borrelia is very resilient. It's very hard to eradicate completely from the body. And one thing is not because they're stronger than our white blood cells. Our white blood cells, the neutrophils and so forth, can destroy it, but it is sneaky. So let's say it over here. Borrelia is, or said, has adapted, we should say has, or evolved to be great, not good, but great at hiding. Knows how to hide, and hides within cells. So it knows how to hide, so that's why it could be resilient. And by the way, if you're looking at the symptoms and you say, oh my goodness, I have nerve pain, I have fever, I have a stiff neck, oh my gosh, I have Lyme disease, don't just use this to evaluate it yourself. You have to go to the doctor. Let the doctor be a doctor. Don't try to be a doctor. All right, that's our video today.